Guru Shri Dr. Nirmalanandanatha Mahaswamiji and Shri Sauminatha Swamiji. Myself, Dr. Lokeshwari, Professor, Department of Kaumarabhrutya, takes an immense pleasure to welcome you all for today's guest lecture. We are very proud to announce that our institution has successfully completed 25 years. As a part of Silver Jubilee celebration, Department of Kaumarabhrutya is organizing guest lecture on Understanding Balagraha in Present Scenario by Dr. Srinidhi Kumar Acharya. I take this opportunity to welcome our beloved principal sir, Dr. Kiran M. Gaur, faculty and students on behalf of our institution and department. Welcome one and all. Now, I would like to invite Dr. Jyotsna to introduce our guest speaker. Over to you, Dr. Jyotsna.
Thank you, ma'am. Jai Shri Gurudev. Myself, Dr. Mangala Jyotsna, Assistant Professor, Department of Kaumarabhrutya. I am very much blessed to introduce our guest speaker, Dr. Srinidhi Kumar Acharya sir. Sir has completed his undergraduation from SDM College of Ayurveda, Udupi in the year 1999 with distinction in all the three professions. He has completed his post-graduation from IMS Banaras Hindu University, Varanasi in 2003. He has also completed PhD from Rajasthan Ayurveda University, Jodhpur in the year 2011. Sir is presently working as Associate Professor in the Department of PG Studies, National Institute of Ayurveda, Jaipur, Rajasthan. He has got 18 years of teaching experience of both undergraduate and postgraduates of Ayurveda. He served as Assistant Professor and Reader in the Department of Kaumarabhrutya, SDM College of Ayurveda and Hospital, Hassan, for more than 6 years and active in many successful health programs launched. Since 12 years, he is rendering his service at Department of PG Studies in Kaumarabhrutya, National Institute of Ayurveda, Jaipur. He is also involved in research activities in Ayurveda since last 18 years and guided more than 20 research papers at postgraduate and PhD level. He is recognized guide for PG and PhD. He also extended his service as examiner, paper setter, member of inspection committee at different universities and delivered more than 30 guest lectures at national, international seminars, CME and workshops. He has the credit of publishing more than 40 research articles in various international, national and peer-reviewed journals. He authored the textbook of Kaumarabhrutya titled Acharya's Textbook of Kaumarabhrutya in 2 volumes and gets published from Chaukambha Orientalia, Varanasi. He is actively involved in clinical and patient care activities as a consultant Ayurveda pediatrician. He is also involved in Ayurveda awareness programs and his programs were telecasted in Doordarshan, ETV and radio. Now, I would like to welcome Sir to deliver his speech on approach towards Balagraha in the present scenario. Over to you, sir.
Am I audible there?
Yes, sir.
Yes, sir.
Okay.
You are audible, sir.
So screen is visible there?
It's not visible yet, sir.
No?
No.
No, 1 minute. So screen share करना एक बार इसमें एक बार screen share कर दो इसमें ना पता नहीं कुछ प्रॉब्लम हो रहा है,
हो गई है।
नहीं आ रहा है। शेयर स्क्रीन, yes, visible now.
Yes, sir. It's visible.
Yes, okay, thank you very much, all the organizers of this particular webinar. At the outset, I would like to thank you one and all for giving me this opportunity. I hope I'm clearly audible. Am I audible,
Audible,
there?
sir.
Yeah, okay.
Sir, could you please make it slideshow?
Yeah. Okay, so
Yeah, done. Yeah.
Graha Rogas. So I have been told to talk regarding understanding the Graha Rogas in the present day pediatric practice and how it can be applicable in the present day scenario. And more than that, we need to understand what actually the Graha Rogas are and what they mean in clinical practice. This point, this point we need to understand very clearly. So I will start with the basics. Please, if I am not audible, just tell me, just inform me. I will carry on.
It's clearly
No.
audible, sir.
Okay. Now, when we talk about Graha Rogas, we know that this is one of the important subject matter of Kaumarabhrutya, because in the definition itself, there is a big place is given for Graha Rogas. Kaumarabhrutyam nama Kaumarabharanam Datrik Shira Dosha Samshodhanartham Dushtasthanya Grahas Samuttanancha Vyadina. So, although this is the main subject matter of Kaumarabhrutya, unfortunately, very less has been talked regarding this particular topic. Why it becomes a untouched topics, even for the teachers, even for the students throughout the course? Maybe Graha Rogas we find more mythological explanation. Because of more mythological explanations, the Ayurvedic physicians or the Ayurvedic scholars are not able to understand what actually he want to say, and they may be failing to decode the hidden message which is present inside. And that may be one of the cause why this is still an untouched topic. Second thing is, it is difficult to understand the concept also. When we talk about Graha Rogas, it is quite difficult to understand the concept because many of the time you are not able to correlate it clinically, and so many stories are there, and scientific understanding of this is not available anywhere. So many of the time students and teachers, they fail to understand. And number three, why it is still untouched is we don't know the clinical utility of the subject. Although we read it well, and where to apply and how to apply, this part is also not known to us. And Graha Roga is such a topic where scientific truth has been explained under the religious bottle. There are so many mythological explanations. Okay, so we are not able to open that religious bottle, and that may be the cause why it's an untouched topic today also. And many of us think that it is an outdated topic. So this present talk is just an attempt to understand certain basic concepts of Graha Roga and how well it is related with the present day scenario, and also how well it can be clinically utilized. Now we come to the basics. Usually we find two important terms in clinical science. One is Graha Roga, another one is Graha Chikitsa. If you see the definition of Ashtanga, Kaya, Bala, Grahodvanga, Shalya, Damsha, Jara, Vrushan, Kaya, Bala, and after Bala Chikitsa, Graha Chikitsa is explained. Now the question comes, Graha Chikitsa is a separate branch which is explained in Ayurveda. Then what do you mean by the Grahas of Kaumarabhrutya? In Kaumarabhrutya definition also, Dushtasthanya Grahas Samuttanancha Vyadinam. Now, whether the grahas which are mentioned or the concept which is explained in the context of Graha Chikitsa as a separate branch of Ayurveda, and the grahas which are explained in the context of Kaumarabhrutya, they are one and same or they are different. This is a very important issue which needs to be addressed. Of course, definition of Kaumarabhrutya, you take the definition of Sushruta, you take definition of other Kashyapa, they give more importance for the Graha Rogas. Okay. But they never talk about Graha Chikis. They talk about Graha Rogas. Now the question comes whether they are one and same or different. And talking about Charaka, if you see the Charaka is quite silent about the Balagrahas. Of course, he is talking about different Grahas in Unmad and Apasmara. But as far as Balagraha is concerned, he is quite silent. He don't say anything. Whereas Sushruta and Ashtanga Sangraha explain Balagrahas in detail. Ashtanga Sangraha also dedicated separate chapters for each Graha. If you see in the Uttar Tantra, Ashtanga Sangraha dedicated separate chapters for each Grahas also. Okay. So later books like Ravana Kumar Tantra, Chakradatta, and Gadanigraha, and Vaishyajaratnavali, etc., have also mentioned about the Graha Rogas. Okay. Now, does Graha Roga and Graha Bada are one and same or they are different? See, there are a definite difference are there between Graha Roga and Graha Bada. In case of Graha Bada, in case of Graha Roga, which is explained in Kaumarabhrutya, they are less subjective and more objective symptoms will be there. Okay, in case of Graha Rogas of Kaumarabhrutya, we find more vomiting, skin problems, diarrheal problems, okay, and jwara, then murcha. So many objective symptoms are seen. Okay, comparatively, there is less subjective symptoms. But when you talk about Graha Bada, which is explained in Graha Chikisa, the symptoms are more and more subjective and less objective. They are less objective, rather they are more subjective. Another is, in the Grahas of Kaumarabhrutya, the morphological structure of different Graha Rogas are explained. If they say Skanda, they say how Skanda is looking like, how many arms he has got, what the body looks like. If they explain about Shakuni, they also explain the morphological feature of the Shakuni. Okay. But in case of Graha Bada, which is explained by Charaka and all, they are not specific about the morphological features. Rather say a normal person who is behaving normally few minutes back, suddenly shows some personality changes or behavioral changes, and he start behaving like Deva, he start behaving like Gandharva, he start behaving like Rakshasa, etc. So that means there is no definite morphological features pertaining to a particular Graha is explained in the context of Graha Bada. Whereas Graha Roga of Kaumarabhrutya, he explains very clearly about morphological structure. Now in Kaumarabhrutya Graha Rogas, there is no periodicity is mentioned. In Kaumarabhrutya Graha Rogas, there is no question of periodicity. But if you see the other Graha Badas, most Pakshadva, Dadashadva, okay. So like that, in particular daytime, it increases. In a particular intervals, it will go into increase. This particular periodicity is explained. But in Kaumarabhrutya Graha Roga, this part is not. It is a continuous symptom. Once it is started, it is a continuous symptom. Now, if you see, definite dosha vitiation and pathological changes are explained for Graha Rogas of Kaumarabhrutya. Whereas, particular dosha vitiation is not mentioned for Graha Badas. Dosha vitiation in terms of Kaumarabhrutya, if you see, he even explains the Panchakarma treatment for some of the Graha Rogas. See, when he explains Revati should be given with Virechana, Skanda should be given with the, Vamana, etc. There must be some dosha vitiation here. Then only it is able to say. But this type of finding is not available for Graha Bada. Okay. Then onset and progression is very rapid. So if you see the Kaumarabhrutya Graha Rogas, the onset and progression is very rapid. So it is very difficult to diagnose and also to the treatment. But this part is not there in Graha Bada. Graha Bada, the onset can be predicted because Pakshadva, Dadashadva, Navadva, it is explained. Periodicity is there. So it can be anticipated. It can be clearly anticipated. So this part is not there in Graha Rogas of Kaumarabhrutya. Now, then what is Graha Bada? So Graha Roga of Kaumarabhrutya is completely different from Graha Bada, which is explained in the Graha Chikisa. Certain Graha, there may be personality changes and behavioral changes. So in case of Graha Bada, there is only the personality changes and behavioral changes of a person. And this particular Graha Bada is occurring in a same person. Okay. That same person suddenly start behaving in a different way, and there will be a personality change and behavioral changes. Suddenly a person who is normal start behaving like Rakshasa. There is a personality change. A person who is normal suddenly start behaving like Gandharva. Again, there is a personality change. So start believing. So therefore, this is different from the Graha Rogas, which is mentioned in Kaumarabhrutya. In the meantime, if you see, in case of Graha Roga of Kaumarabhrutya, there is fever which is there, which is mentioned as the most important symptom. The Purva Rupa of this particular Graha Roga of Kaumarabhrutya itself is Jwara and Rodana, continuous Rodana and as well as Jwara. This part is also absent in Graha Bada. Graha Bada may be there with the fever, may not be there with the fever. But Graha Rogas of Kaumarabhrutya is completely different because they have got Graha fever as the main symptom. Now, what are these Graha? What are the causes of these Graha Rogas? Every happening or a disease has got a cause. Now we need to explain why these Graha Rogas occurs, isn't it? Now, every happening disease has got a cause. So this is a Karya Karana. This explains about the Karya Karanavada. So Ayurveda greatly believe on Karya Karanavada. Okay. So what Karya Karanavada says? There is a definite cause for everything in this world. Without a cause, Karananurupam Karyamiti Kritva. Without a cause, nothing is possible in this world. So therefore, if I say if there is a Grahas, definitely, or Graha Rogas, there will be some definite causes. Now, contemporary science says go for certain investigation when the cause is not found. Okay, contemporary science approach is when the cause is not visible, they will say that yes, there is no cause, so now we have to go for certain investigation to find out the cause. And if after investigation also, if the cause is not identified, then they will say yes, it is a disease of unknown origin. Or they just say the disease is idiopathic. Okay, this type of approach is not possible in Ayurveda because Ayurveda strongly believe in Karya Karanavada. We says that if there is some cause, yes, there is some cause, there is some effect is there, definitely there will be some cause. That's the Karya Karanavada. So if there is a disease, I cannot say I don't know the cause. There should be some cause, and that cause is there. Okay, that's the beauty of Ayurveda. He explains Karya Karanavada, and principles are laid down on the same principle. So if there is a Graha Roga, definitely there will be a cause for that. Now, how to name the different types of causes in terms of Ayurveda? Now, how to name and identify the unknown causes in Ayurveda? See, cause is not known, but still the disease is there, just like Graha Roga. The cause is still not known, but disease is there, or cause is invisible, but the disease is there. But we need to name the cause. The disease cannot exist without a cause, as I told earlier. Ayurveda believe in Karya Karanavada. We says that Analpam Apratyaksham, Charaka says. That means invisible entities which are present in this world are enormous. Visible entities are very less, but invisible entities are more. Okay, so we believe in Analpam Apratyaksham. Therefore, so many invisible causes are there which are not seen, and we need to find out some cause out of that for the Graha Rogas. Now, see, Ayurveda explains when the cause is not known. Ayurveda explains two important things. If the cause is not known and it is a chronic presentation, suppose, just like in Down syndrome or different types of syndromes, then Ayurveda says cause is not known, but presentation is very chronic. Then Ayurveda says it is Purva Janma Krita Papa, or it may be occurring because of Daivika Shakti, or it may be occurring because of Atma Karma. Second is, if the cause is not known, but presentation is very acute, then Ayurveda say cause is not known, invisible, but presentation is very acute. It is taking the life of the child. Then it is called as Bhutha, Preta, Pishacha, Graha, Jataha, Matrikayas, Rakshasa, Asura, etc. are considered as cause for this. Okay, so hence what we are discussing, Graha Rogas, they are counted in acute or emergency or severe presentations with the cause is not known. Cause is still not known. We need to find out the cause, but cause is still not known. And it is causing an acute emergency. So such set of disorders are included under the category of Bhuta, Preta, Pishacha, Graha, Jata Harani, Matrikayas. Hence, such Graha Rogas are counted in acute emergency and severe presentations with cause unknown. Now, what contemporary science say when the cause is not known, not visible? When the cause is not known, contemporary science try to find out it by physical examination. When the cause is not found by even by the advanced investigations, the cause is so potent it turns unnoticed. So idiopathic cause is not clearly known. And they explain about fever of unknown origin. They explain about idiopathic epilepsy, idiopathic thrombocytopenia, nephrotic syndrome, idiopathic, etc. What I mean to say is, according to modern science, it is very clear. If the cause is not known by the naked eye, and if the cause is not known by the investigation, they simply say the cause is idiopathic. They simply admit that cause is not known. It is not known. But Ayurveda never says like that. Even the cause is not invisible. In spite of limitations of investigation in those days, they try to find out the cause by Karya Karana Vada. And Graha Rogas are produced because of such causes where the cause is not known and the presentation is acute. All set of disorders are included under the section of Graha Rogas. It is not Graha Chikitsa, Graha Rogas. Now, with all this understanding, we will take a theory. Now we will take a hypothesis and let us try to prove this particular theory. Okay, I will take a simple statement that Graha, Bhuta, Preta, Rakshasa, Pishacha, Jataharani, Asura can be considered as different microorganisms like virus, bacteria, protozoa, spirochetes, etc., which are widely spread in this universe. This is a hypothesis, just. I'm not talking about any theory. Now we have to prove this particular hypothesis, and if you are convinced at the end, let us take this as a theory. Otherwise, keep it as hypothesis. So let us start with the presentation of hypothesis. Now, how to understand the grahas? It's very simple. In the classics, Ashtanga, Sushruta, and Kashyapa, they very clearly says, Grahanat iti grahaha. So when they say like this, what actually it means? Grahanat iti graha. That means it is the one which comes and attacks the body. Okay. So anything which is coming and attacking the body, that suggests that that is a living organism. That suggests that that is a living organism. So one thing is very clear. Grahas are living entities. They are not non-living entities. They are living entities. Again, the classic says that grahas are the one which cause the himsa. When they enter inside the body, they cause certain amount of himsa. Himsa not suggests towards killing. Himsa suggests towards torturing. The word meaning of himsa is not killing. Word meaning of himsa is torturing. So what I mean to say is, these are the entities. That means Graha Rogas are the entities which come inside the body, and after coming, they will cause torture to the body. That means there is a fight going on in the body, and they cause some damage to the body tissues. Okay, so that is the nature of what you say grahas. That suggests that these grahas are not body friendly. Rather, after entering inside the body, they will cause some problem to the body. I mean to say, they have got certain antigenic properties. They have got some antigenic properties when they enter inside the body. Next, they will say that grahas are very much bhayanaka and amhanusha. It means they are looking very bhayanaka and also amanusha. This particular statement suggests that incidence of Graha Rogas carries a high mortality rate. Incidence of Graha Rogas, they carries high mortality rates. Now, one more sentence which is told, or word which is told is, Grahas always like to move in the night hours. that is mentioned as Nishachara. That is mentioned as Nishachara. They are not interested to move in the daytime. Rather, they like to move in the night hours. That suggests that they like to move in the darker areas. Okay, they want to move in the darker areas. Next one is, it is also told that it is a Graha Rogas will go into cause the Prachanna Vyadi. The word meaning of Prachanna is hidden. That means Graha Rogas are going to cause the hidden Vyadis. That means entry of Grahas inside the body is left unnoticed. Okay, only after the beginning of the symptoms you come to know that yes, something has gone inside and causing problem to me. So this is causing the Prachanna Vyadi. And it is also told that Grahas will going to cause the Tivra Rogas. Tivra means very severe disease. The presentation will be very, very Tivra. Presentation will be very, very acute, and presentation is very severe. Next, one more important thing which is told in the Graha Roga is they frequently changes the size and shape. They frequently changes the size and shape. Now this is important. Grahas will go into change the size and shape according to the requirement and the situation demand. If the demand of the situation is to change the shape, they will go into change. And one more important thing which is told about the Graha is they are invisible by the naked eye. They are not visible by the naked eye. Okay, you need some extra visual aid to visualize it. If extra visual aid is there, you can visualize. By the naked eye, they are not visible. Another thing, to treat the Graha Rogas, what Ayurveda says, Ashtanga says is, Apthavakya should be considered. That means you cannot treat the Graha Rogas so easily. To treat the Graha Rogas, we require the help of the classics, or we require the help of the previous experiences, past experiences. Just like a consultation, we required a Aptavakya should be considered. And further, they says that Grahas are not visible by the naked eye, rather they are only visible by the Jnana Chakshu or Divya Chakshu or Shastra Chakshu. Okay, the word meaning of Shastra Chakshu or Divya Chakshu is, it is a knowledge, eye of knowledge, vision, knowledge, vision. And Jnana Chakshu is again it is the knowledge or vision of knowledge. That means you should have a greater knowledge to understand the concept of Graha Rogas and even to visualize it. Avishantasya lakshante kevalam shastra chakshushaha. That means the message is very simple. By the naked eye, this is not visible, but if you have some special visual aid, that special visual aid may be mechanical, that may be academical, or that may be knowledge. Okay, by that you can understand the concept of grahas, otherwise it is not possible. Now, by looking at all these basic things of Graha Rogas, now we will further analyze the same. Now, if I say I have took the hypothesis, isn't it? Now it is my work to prove it. So I say grahas are living entities because they are moving, and microorganisms which are present in the universe are also moving. We know that they are invisible, but they are moving. Similarly, I told grahas are nishacharas, like to move in the darker areas, usually Thama area or darker area. Darker areas usually have low temperature with a high humidity. So all the pathogens, they always like to reside in the low temperature, high humidity areas. Okay, of course, there are some exceptions, rare exceptions. Otherwise, most of the microorganisms, they want to live in a low temperature and a high humidity areas. And same has been explained in Ayurveda as Nishachara. Okay, so non-illuminated areas are the most favorable places of microorganisms. Similarly, one more is invisible, but they are living, but they are not seen by the naked eye. What it suggests? It suggests they can be seen by a special visual aid. The microorganisms are also not visible by the naked eye. We need a special visual aid in the form of microscope. It may be electronic microscope if you want to see the more size, bigger size. Okay. So again, Graha Rogas and microorganisms, they again follow the same rule. And it is told in Graha Rogas that they will go into change the shape and size as per the situation. Similarly, microorganisms also change their size and shape as per the situation. If you see the parasites, they will start from egg, then become larva, then become adult worm, etc. And if you see amoeba, it is known for changing its time and space from time to time. So many other bacteria, they frequently change their size and shape according to the requirements. Okay, so that's one more thing which is also seen in microorganism and which is also seen in case of a Graharogas. Now, one more important thing is it is told that Graharogas will going to cause the himsa, isn't it? Similarly, all the bacteria, all the microorganisms, they come inside the body and they will going to cause an immune reaction which may be irritable to the body and torturous to the body. For example, when a virus goes inside, we know that how it causes a cough which is so much irritable to you. Many times a pathogen goes inside the body, it causes the fever which is uncomfortable to you. That means they go inside the body and cause the himsa or pain. So this suggests the antigenic property of the pathogen. So pathogens also shows the antigenic property, and same property is also explained for the Graharogas. Now it is told that Grahas will going to cause both disturbance of both body and mind. Karma shastu matastesham daiva yuktyashrayam sadaha. That means in case of Graharogas, you have to do both daiva vyapashraya chikitsa and also yukti vyapashraya chikitsa. Okay, that means it suggests that there is involvement of the both body and mind. So we have to treat the both. That means it is causing the generalized disease. Similarly, when pathogens enter inside the body, they also cause certain generalized symptoms. For example, fever. That is a generalized symptom. Vaichityam maratir glani manasantapa lakshanam. In case of fever, it shows the involvement of the mind. Okay. Similarly, there will be deha santapa lakshana. So affliction of body and mind is seen in case of microorganisms, and same way it is also seen in case of Graharogas. And lastly, he says that there is a need of empirical treatment. I think you know empirical treatment. In case of pathogens, microorganisms also most of the time we follow the empirical treatment. Many times when the fever comes, until the culture study was done, we are not knowing about exactly what exactly the pathogen is. But still we try to start with the treatment on empirical basis, because we know which is the most prevalent bacteria or pathogen which is present in this particular area, and accordingly we will give some antibiotics or treatment, etc. This is a trend of modern medicine. But exact pathogen was identified only when the culture study was completed. But before that, they start the treatment. So how it worked? They worked on the past experience, because they know that in this particular area, this particular infection is prevalent. Therefore, I am going for this antibiotic as a anticipatory method. Similarly, in Graharogas also he says, treating Graharoga is not so easy, and you have to take the past experience into use. Okay, either you have to take the past experience present in the science, in the Shastras, or different Vaidyas who are treating it. So this is again proving that the treatment principles of Graharoga and pathogens are one and same. So we have gathered so many points: shape and size, invisible nature, living entities, likes to move in the night hours or like to stay in the humid atmosphere or less illuminated areas, need a special visual aid, okay, need to do a treatment for body and mind. You know, many of these points very, very clearly suggest that Graharogas, which are explained in Ayurveda, it is nothing, especially in Kaumarabhrutya, they are nothing but the microorganism. But if you are not still satisfied, we'll go further. In relation to Graha, many of the other disorders are mentioned, isn't it? Acute presentation disorders are many. One is Graha. Similarly, Bhuta, Preta, Pishacha, etc. are also explained. As I told, they can be kept in the same category. Graha, Bhuta, Preta can be kept in the same category. Now, what I will say, what do you mean by Bhuta and Pishacha? Ashtanga says, Ashtadashaha Bhuta Adipatayaha Tadyashaha. Okay. So he says that Bhutas are those entities which always likes to be there, reside near the Mamsa. Okay. Mamsa or Pishita. Bhuta and Pishachas are those entities. See, Nishardha Charini Ivoho Bhayanakaha Mamsa Asrak Ashinam. Rakta and Mamsa, they want to be there. Okay, they want to be there in the area where there is Rakta and Mamsa. Okay, Visheshatah Vranina, especially in Vranina, that means especially in case of infectious conditions, the affliction of this Bhuta and Pishacha is more. Puya Rakta Sneha Gandena. That means an unhygienic atmosphere, unhygienic living conditions, unhygienic skin conditions, unhygienic body conditions. In case of runas, and especially they are like to be there with the mamsa and asrak. That means basically what they want is they want mamsa and rakta. Okay, wherever there is rakta and mamsa is there, they will go and stay there. That's the nature of bhuta. Okay, number one, just remember it. Number two, preta. When we talk, so bhuta and pishacha are one and same in the same category. Now preta. So what is punarutpatti hetu? The derivation of preta is punarutpatti hetu. Exact meaning of preta is they are craving for re-existence. Punarutpatti hetu. Preta is that entity which is trying to get reproduce desperately. Okay. Philosophically and spiritually, we talk about preta means if a atma didn't find a body to enter, that it's roaming in the air, and that entity is called as preta. That is philosophically explained. But the word meaning goes, punarutpatti hetu, it want to reproduce itself desperately. Now question is, if it is want to reproduce itself desperately, it want a body, then only preta will go inside and reproduce itself. Okay. Similar concept is explained for the microorganisms. Now, if you see, a microorganism can grow well and increase its colonies, increase the reproduction and number only when the host is available. There should be some host. Most of the microorganisms use animal, birds, and humans as their host for completion of their life cycle, for their existence, for getting nutrition, etc. Now, if you see the definitions of this Bhuta, Pishacha, and Preta, what they want to say is, Bhuta and Pishacha, they want Mamsa and Asrik, and Preta is desperate to get reproduced. That suggests that they are in search of a host. They are in search of a host. Host tendency is typical of microorganisms. Any of the pathogens, they will have the host tendency because of single-celled organism. Themselves, they cannot do anything. But once they enter into the body of the host, they can do the magics, cause so many problems. Okay? So, therefore, Graha, Bhuta, Preta, and Pishacha, they comes under the same category. Graha, Bhuta, Preta, they are desperate to find a host. Once the host has they got the host, they start replicating. Okay? So, for that particular, when they say Mamsa and Rakta, it suggests that Mamsa and Rakta is available in the host where they can reproduce. Similarly, when we talk about Rakshasas, another explanation is given. Rakshasa is one from who one has to do its own Raksha. Therefore, we explained about Rakshogna Homa. Rakshogna Homa is against the Rakshasas. Okay, they like to reside the Mamsa, Rakta, and Vasa. They also like to reside near Mamsa, Rakta, and Vasa. We have got a different Gana also, Rakshogna Gana. It contains Siddharthaka, Sala, Gugulu, Vacha, Sarshapa, etc. Those are strong aromatic drugs which are anti-infective in nature. Okay, so Rakshasa has got a Amanusha in nature. They are very, very inhuman. Okay, that means so they can cause different types of injury and mortality rate is very high. So till this slide, what I mean to say is Graha, Bhuta, Preta, Pishacha, and Rakshasa comes under the same category, and depending upon their host variability, we have given the different names. That's all. Now, we know that Grahas are Bhuta, Graha, Preta are innumerable, and similarly, it is told that microorganisms are also infinite, isn't it? In the room where we are sitting, it may contain lakhs of microorganisms, but it is still not visible. Only thing is, it is apratyaksha, not visible, but still it contains so many microorganisms. We in a particular room is only 10 or 15 members, but microorganisms are in terms of lakhs. So they are countless or infinite. Okay. The same thing is explained in Ayurveda for Graha and Bhuta Preta etc. Te punaha pratak koti parivaraha. Okay, they have got innumerous number, infinite number. It cannot be removed from the universe, and there are infinite number. So this also again suggests that this particular entity of Bhuta, Graha, etc., they can be compared with the microorganisms. The microorganisms are also invisible. Bhuta, Preta, Grahas are also not visible. They are invisible. That also have the antigenic property. Grahas also have the antigenic property. They are also innumerable in number, and Grahas are also innumerable number. Itya ananto Bhutalokaha. In the Bhutaloka, that is Bhutaloka, the world of microorganism is innumerable, infinite. Now let us see about this particular Graha Rogas or Bhuta Preta and the non-zygotic nature of the Grahas. This is quite interesting. See, we explained about the Graha Rogas, isn't it? One of the main Graha that we will see later, that is Skanda Graha. And in the Skanda Purana, there is a story regarding the production of Skanda Graha, and this will going to guide us about the nature of the Graha Rogas. What is that story? I will tell in very short. That's a little bit mythological. See, Shiva and Parvati, so they were in Kailasa, and once they are in very good mood, and they decide for a coitus. They decide for the coitus. This is how the story goes. And during the Maithuna Kriya, what happens? Before the act of the coitus, the Maithuna of, in the process of Maithuna Kriya, before the act of coitus itself, the sperm of Lord Shiva has fallen down. Okay, form of Lord Shiva has fallen down, and the place where the sperm has fallen down, from that particular place, a graha by name Skanda is produced. This is Skanda Purana says about the mythological origin of Skanda. Now, from the site where the sperm has fallen, the graha originated, and after immediately getting born, Skanda suffered with restlessness, and he wants desperately something to eat or something to go inside. Okay, he wants some, desperately he wants. The story goes like Trishna, he developed Trishna, and he develops Trishna and Kshuda. So he wants something to eat desperately. This is how the story goes. Now take the message out of it. Graha, Skanda Graha, he told that Skanda is produced when the sperm of the Shiva falls down on the earth. That suggests that the production of the Graha is not zygotic in nature. What I mean to say is, there is no mixing of the sperm and ovum, and there is no formation of the zygote, and later onwards there is a production of a whatever Graha. This sequence was not followed. That means zygote is not formed here. Before the formation of the zygote itself, the Skanda was formed because of falling of this sperm. That suggests that the Grahas are non-zygotic in nature. Grahas are non-zygotic in nature. Most of the vertebrates and different other animals, they are zygotic in nature. There's a gametocyte formation and all. But here, the Grahas are produced by a non-zygotic nature. And if you see, all the microorganisms, basically they are non-zygotic in nature. Their reproduction takes place either by the spores, asexual spores, or some other methods. There is no formation of the gametocytes. Okay, so again, this suggests that microorganisms are also non-zygotic in nature, and the Grahas are also non-zygotic in nature. Meantime, what happened to Skanda? He developed Kshuda and Pipasa immediately after birth. He desperately needs something to survive. Similarly, all the microorganisms require a host immediately after their production. Once the host is not available, or they didn't got the host in a stipulated time, they will going to die. We know that so many microorganisms are there, but many of them will going to die. Why? Because they didn't find the host in the right time. So they can be destroyed by the cold, they can be destroyed by the temperature, etc., heat, etc. So what happens to a microorganism to survive? Host is very important. Just like Skanda carved after the production for getting inside one's body for its reproduction or for its survival. So two things are very clear. Grahas are non-zygotic in nature, and second is Grahas desperately want a host. The same tendency is also seen in case of microorganisms. Microorganisms want a host immediately, and also microorganisms are non-zygotic in nature. So by looking at all these things, the grahas are invisible, living entity because it is microscopic nature. It passes through the different phases of the life cycle. Therefore, it changes its size and shape frequently. They are antigenic to the body and cause pain and torture. This part we have seen can be visualized by the special aid like microscope. It leads to the generalized involvement with the acute, rapid, severe presentation. It follows the incubation period. What do you mean by incubation period? Incubation period is that period from the entry of organism inside the body to the production of the first symptom. Grahas also follows the same rule. What he says is, entry of Graha Rogas inside the body is invisible, just like Atma entering inside the body, just like the Thaila entering inside the Bija, and just like mirror and the image entering inside the mirror. Similarly, entry of Graha Rogas inside the body is invisible. This suggests that Grahas enter inside the body, but we don't know. That means it follows a period of incubation period. And presence of an incubation period, and you know only that grahas are afflicted after the appearance of the first symptom. So presence of incubation period is very typical of all the microorganisms, and almost a similar explanation is explained for the Graha Rogas also in the form of a incubation period. One more is, fever is the first symptom in any infection. We know that. When we come to know that there is a fever, fever is usually, as per contemporary medical science, fever is present in case of infections in 99.9 conditions. There are some exceptions like drug fever, metabolic conditions, thyrotoxicosis, etc. But otherwise, in majority of the cases, it is a fever which indicates that there is an infection. And if you look into the Graha Rogas, the Purva Rupa of all the Graha Roga is Rodanam Jwara. There will be fever. So fever is the first symptom in almost all the Graha Rogas, and fever is the first symptom in almost all the micropathological or microbiological infections. Okay, so again, this proves one more important point, that Graha Rogas can be better compared to the microorganism. So thus grahas can be a terrible or bhayanaka, and they desperately need a host for their existence, and they are moving towards the host as its naturally tendency, and movement towards this area is less resistance. They always move to that area where there is a less resistance. This is one more important thing. When we compare microorganisms and Graha Rogas, now we can come to a conclusion that both are very bhayanaka. Some of the microorganisms are very, very dangerous. Similarly, some of the Graha Rogas are also very dangerous. And they desperately need, when I say Graha Roga, it suggested Graha, Bhuta, Preta, Pishacha, Rakshasa, etc. everything. They desperately need a host. It want Mamsa and Vasa and Rakta means they need a host. Okay, so they desperately need a host for their existence. They are moving towards the host as a natural tendency. So their natural tendency is always towards the host. Isn't as we move towards our home in the night hours, it's our natural tendency, isn't it? During the evening hours, we will have an instinct feeling that yes, now I have to move towards my home. That's the feeling, natural tendency. Similarly, Graha Rogas also move towards their host. And who is their host? Host is humans or animals or birds. So entry of grahas inside the body, it is a host dependent natural tendency. Similarly, microorganisms also moves towards their host like humans. It is a natural tendency. You cannot blame them. Just like you are moving to your home in the evening hours, similarly, Graha Rogas also their protection purpose, for their survival purpose, they move towards the host, and unfortunately that host is human being. Okay, and if the host resistance is more, and if the host immunity is more, they are not able to move inside the body. They have to go back. Okay, so now if Graha Rogas entering inside the body, or if the microorganisms are entering inside the body, the problem is not with the microorganisms or grahas, it's a problem with our host defense, our immunity system. Okay, so they want something for their survival. It is told that bubukshitaha kim na karoti papam. It is a hungry person, he is ready to do any sin. Similarly, it is a matter of existence, survival for the pathogens or grahas. So definitely they move towards the host. So you find a host, they will survive. Others, they will going to die. So definitely they will try their level best to enter inside the host. Okay. So the movement is always towards those areas with the less resistance. If your body is offering less resistance for their entry, they comfortably come in. And if the body is giving more resistance, they are not able to come in. Now, so far we have explained, I have summarized in the table. See, Graharogas and microorganisms. Graharogas are also living entities. Microorganisms are also living. The prone type of movement in Graharoga is night hours, Vishachara. The prone movement time for the microorganisms is also dark area and low temperature areas. Then method of invasion is the Grahas invade by holding, seizing the body, attacking and causing Prachanna Vyadi. Similarly, microorganisms also entry will be identified only after the first symptom. Incubation period is followed in Graharogas. Okay, entry of Atma not inside. So explained already. Similarly, this also same. Then about the presence of the generalized involvement will be there, both body and mind. Presence of the fever, it is one of the main Pururupa in Graharoga. Similarly, presence of the fever is a Pururupa in case of, or symptom in case of infection also. Visibility, Grahas are also invisible and visible only through the certain visual aids or special vision power like Jnana Chakshu, Divya Chakshu, etc. Microorganisms are also visible by the not visible by the naked eye. They are visible only by the microscope. Entry inside the body, they enter inside the body due to following of adharma. It is very clearly told why grahas enter inside the body. Classics say that they enter inside the body when you follow the adharma. Because when you follow the adharma, it creates a loopholes and entry will be easy. That suggests that when you follow the adharma, adharma means wrong way of living in terms of diet, in terms of achara, vichara, ahara, vihara, that decrease your body immunity and it makes the Graharogas more prone to enter inside the body. Similarly, in case of microorganisms also, the human body, they're always in search of a definite and indefinite host. And whenever the host immunity falls, the organisms comes inside. Now, diagnosis also, it is told that diagnosis is very difficult in case of Graharogas because of rapid onset, progression, and severity. Similarly, in case of microorganisms, also exact diagnosis is very difficult. You can say either it is a viral, bacterial, or parasitic, but which particular bacteria, which particular virus, this is only possible after culture study, that too with a great difficulty. Okay, so diagnosis is there also, it is very difficult. Now, treatment, if you're talking in case of Graharogas, it is told that Aptavakya should be followed, suggesting the need of an expert's opinion. In case of microorganisms also, when you are treating the infections, prevalence rate of infection in a given area and empirical treatment should be followed. Now, very important, what is the intention of entry? Graharogas enter inside the body with the three important intentions. I will go into discuss it in detail. Himsa, Rati, and Archana. Similarly, microorganisms, they also enter inside the body with the purpose of causing himsa, that is tissue injury, Rati, that is with completion, with the intention of completion of their sexual cycle, and Archana, that is with the intention of get nourished. That I will discuss later. Now, what is the outcome of invasion? Once the Graharogas enter inside the body, what it will do? What the micropathology organism will do? Graharogas, it is told that Graharogas, after entering inside the body, they will do the raksha of the body. Okay, because Graharogas are produced with a very good intention of protection of the son of Shiva, that is Shanmukha and Ganesh. Okay, actually Grahas are produced in this world, that is with the intention, good intention of protection. Similarly, microorganisms are also there in this world with a good intention. I will not go in detail. They play a very important role in maintenance of the ecosystem of this universe. You cannot imagine the world once the microorganisms are removed from the world, because human evaluation starts from the lower animals, from the microorganisms. From there only the humans are evolved. Therefore, they are the basic thing. They maintain the ecosystem of the universe, that I will explain later. So they also are very important and brings the immunity. After every infection, there will be immunity. Similarly, after any graha rogas, there will be certain type of raksha. Now, why microorganisms attack the body? This is the basic question, isn't it? Organizers, am I running out of time? Hello?
No, sir. No, sir. You can continue, sir.
For how many more minutes I can continue? Please tell me.
Yes, sir, it is audible.
Till 12:15, it can be continued, sir.
Till 12:15. Okay.
Yes, sir. Yes, sir.
So why microorganisms attack the body? And it is told that Datri, Matru, Praklishta, Upachara, so many organisms, causative factors are given. To summarize all those things given in Sushruta, the main cause of attack of organisms, microorganisms inside the body. In this context, the main cause of attack of grahas inside the body is, if you see the shlokas, and I have summarized, it is either hygienic issues related to personal or community hygiene, personal hygiene of the child, personal hygiene of the mother, or etc., or community hygiene. Another important is low socio-economical status. That's one of the main cause why the grahas enter inside the body. Low socio-economic status means they are not able to maintain the hygiene, they are not able to maintain the, what you say, the nutrition and all those things. Another is adulteration of the food. In a very symbolic way, it has been mentioned that you should not eat in a broken vessel. That suggests that the diet should be proper. It should not be adulterated. It should not be more fermented, or it should not be putrefied. Freshly prepared food has to be taken, because that is also one of the sources of microorganisms or graha rogas. Contaminated air, water, and milk. All this information has been given in Revati Chikitsa Adhyaya also, Revati Kalpa Adhyaya of Kashyap Samhita. Epidemic and endemic nature. When epidemic and endemic breakdown is there, there may be infections or entry of grahas. Environmental hazards, there may be the entry of grahas. Sudden changes in the climate. We know that during Amavasya, during Grahana Kala, then during Purnima, there will be sudden environmental changes. Okay, so which may be conducive for the entry of the grahas or production of some of the microorganisms in the universe. Then Rutu Sandhi Kala and Yamadamshtra Kala, early rainy season, late summer season. We know that so many viral infections start. Late rainy season, so many viral infections start. Similarly, all these timings are considered as most vulnerable area for the graha rogas or organisms. Why microorganisms attack the body? Why they attack the body? Again, see, the production of the microorganisms or production of the newer grahas, if you so look into the classics, either it will be during the time of the drought, flood, war, or excess destruction. If you see the stories related to the production of each grahas, every time before the production of the graha, there will be a big quarrel taking place. For example, in case of Putana, there is a big quarrel taking place between Skanda and the last one Rakshasa in the Krauncha Parvata. Okay, that's a very big fight, long like a world war. And after that war, the graha Putana is produced. Similarly, after a big war, the Revati graha is produced. So what I mean to say is, so many microorganisms evolve, newer microorganisms evolve after a drought situation, flood situation, war situation, or excess destruction. We know that about after First World War, there is emergence of anthrax and so many swine flus. Okay, so that is because the bad effect of adverse effects of the World War after the debris and all, they collected at a time, a lot of destruction is there, putrefaction is there, and newer microorganisms get evolved. Similarly, in the context of graha rogas, also it is told that after a big war, so many grahas entered inside the earth. So improper disposal of the waste and dead body also one more important cause. Then it is mentioned in the classic that grahas can also occur because of sahasa karma. Sahasa karma, doing excess work without considering own body strength. Sahasena, deha balam, Anapeksha yat kriyate tat sahasam. When you are doing the bodily activities or work without considering your own body strength, then it is considered as a sahasa, and that is also one of the cause. Then contact of contaminated person. Okay, we know that upasargika rogas, etc. Traveling from one area to another area. This is also explained in Revati Kalpachikissa as a cause of Graha rogas. Okay, neglecting the time to time health tips given by concerned authority. It is explained as Guru Rishi Shapa. Guru Deva Rishi Shapa. This is one of the major cause for Graha rogas according to Kashyapa. And what he says that if you're not giving, if you're not following the health tips which is given by the experts, because in those days the experts were Guru, Deva, and Rishi, and they are the source of knowledge, and they used to give the tips. And if you're not following the tips given by them, definitely you will be the victim of a particular infections or Graha rogas. The same is true in the nowadays also. If you don't follow the advice of a particular specialist or consultant, you will be in trouble. So overcoming the expert's advice, that is also considered as one of the cause. Any conditions which weakens our immune system, that has been told as adharma. If you are indulging in adharma, that is a wrong way of living in terms of ahara, vihara, achara, and food, etc. And that is also one of the major cause. Now, why grahas, this part I have covered, why grahas and jatarani attack the body? I told adharma. Adharma means wrong way of living. Adharma, asadhyayada vishati revati. In the revati, it is told that adharma is the root cause. In the Graha rogas also it is told that adharma is the root cause. And adharma is also the root cause for the Janapatodvamsa rogas and Upasargika rogas. And it is a Skanda's order. If you again go into the story, Skanda is the leader of all the grahas mythologically, and he orders all the other grahas to go and attack those people in the Bhuloka who are not following the dharma. Okay, so it's a Skanda's order. Adharma is that act which disturbs the physical, physiological, psychological, spiritual, and social health of a person. So this is possible by not following Swasthavrta, not following Sadvrta, Dinacharya, then Rutucharya, Achar Rasayana, and personal hygiene and Dashavida Papa, etc. So adharma create the loopholes in the body and make the body more vulnerable for the Graha rogas. What I mean to say, adharma makes the body more vulnerable for the microbiological micropathogens. Okay, this creates the loophole in the immune system of the body. This creates the loophole in the immune system of the body. So now why grahas and the jatakarnis, they attack the body? So it is told very clearly, pralupta dharma, that is deviation from the dharma. Okay, and if you are having kama and krodha, lobha, mada, etc., then bhinna vritta, change in the conduct. It may be your daily routine or it may be your psychological aspects. When there is a change in conduct, you are not following a good lifestyle. That is bhinna vritta. That is a cause for the entry of grahas. Bhinna achara, change in the lifestyle. Ashaucha and maliya sahasi, very clearly explained. Unclean and unhygienic environment. And if you see, the same or the cause for the entry of microorganisms or infections in the body. Now talking about role of consultation. This part I have explained. There is a role of consultation. You have to take the expert's opinion, isn't it? So treatment of the infectious disorders needs support in many ways. Expert's opinion, investigations, reports, etc. Similarly, consultation of the Brahmins, gurus, sages who were the source of knowledge in those days is required. And the lack of consultation may lead to wrong management and diagnosis, which is quoted as Guru Shapa, Deva Shapa in the classics. So they are respected with the religious outlook. So there may be certain psychological effects also. This part I have already explained. Now we come to the main thing. Why grahas attack the body? In the context of the Bhuta, he says that grahas enter inside the body with the sadhyo prajnoparada, the prajnaparada which is caused recently, sadhya. Recent deviation from the lifestyle, recent deviation to exposure to some of the areas, recent deviation or recent prajnaprada about the food. Okay, and this is the cause. Sadhya prajnapradaha. And he says that sometimes grahas also enter inside the body with the purvakrita prajnaprada. Purvakrita means purva in the recent past, not immediately. Maybe you have been to some areas which is infection prone, like tuberculosis, and after some 3 or 4 months or a year later, you will have the problem. That is purvakrita prajnaprada. It may be sadhya prajnaprada, a sudden contamination, or purvakrita karmasya parinamakama. Maybe sometimes the problems may be because of purvajanma krita. Okay, for Down syndrome patient getting infections, or different things are there. Anyway, papa karma is also major cause. So this is told by Ashtanga. Tesham punar anupraveshe karanam sadhya purvakruto va visheshana prajna prada. That is knowingly doing mistakes which are done knowingly. We know that this is wrong, but still we do that. We know that we should wear the mask, but still we don't wear the mask. We know that social distancing has to be maintained, but still we will not maintain it. And this is prajna prada. In the present context, it is sadhya prajna prada, and that will cause COVID-19. So, anyway, of course, there is also the role of the manas. So I will not go into discuss detail. Then movement in the lonely and inauspicious places, because lonely and inauspicious places are considered as the most unhygienic, because we don't know what exactly it is. What is the prevalent area? We don't know that. So it is an inauspicious place. Fearful condition. Kashyapa and Bhagavata says, baby which is fearful is always prone to get graha rogas. So don't make the baby scared or fearful. Okay, because fearful baby is always more prone to get the graha rogas. Okay, that's about the psychological thing. Then taking the food in the broken vessel. This has been mentioned. I told this is just symbolically he is mentioned that broken vessel should not be used for taking food, and that may cause graha roga. The reasons are many. In the broken vessel, again, there may be collection of the food materials, and it is very difficult to clean it. When left unnoticed, it may be acting as a culture media for the growth of the microorganisms. That's the one thing. Then when he say the vessel, it also suggests the use of different vessels. Copper vessels should not be used, or copper alloy containing vessels should not be used, because they can release copper and all. There may be conditions like Indian childhood cirrhosis and Wilson's disease, etc. See, he is symbolically mentioning everything. Then anger, frightened, and cruel-minded. Again, mityahara vihara, neglecting the hygiene, social, personal, and community hygiene. This is the basic causes of graha rogas, and same is also the cause for the microorganism. Yes, most vulnerable people for the entry of the graha or bhuta, for the most vulnerable. So here he is telling jvaradhyam apohati. That means visheshataha raninaha, the wounded people. That is those who are having already injury. It may be burn injury, cut injury, any injuries. And when there is puya rakta sneha gandena, that is a discharge. So they are more prone to develop the graha rogas. Similarly, we know that microorganisms enters the body, the weak person who is having bodily wounds. Wound is the most important, because therefore we take so much of wound care. Vranita. Okay, Vranita should be cared very carefully. Similarly, wounded person with any type of wound, he is more prone to infection. Therefore, we are doing the bandage and daily dressing and all those things. Okay. Now, entry of microorganisms into the human body. In the meantime, we will also see the entry of grahas inside the body. From the different route, the microorganisms can enter the body. We know. Individual organism has got its own preference, isn't it? Some enters through the oral cavity, some enters through the fecal-oral route, some through the skin, some through the nails, and some through the food. So many things are there. So individual variation has got its own preference and enter in search of, but why they are entering inside the body, I explained earlier. They enter in search of the definite or indefinite host. They don't have any other intention, because that's a matter of survival for them. They want a host. Therefore, they are entering into the human body. To allow them or not to allow them, it depends upon you. And if you're maintaining your immunity good, it will not come inside. Anyway, so enter in search of a definite and indefinite host. They want to complete their life cycle, as I told earlier. They want to get nourished and comfort and increase the colonies. Therefore, a tubercular bacteria, see, when it comes inside the body, the only purpose is it has actually don't have any purpose of causing tuberculosis. The reason is tubercular bacteria is always in a aerobic bacteria, and it always want a high degree of oxygen perfusion for its survival. Therefore, it enter inside the body where it will get high perfusion rate. It will enter the high perfusion in the lungs. So it is coming in search of archana to get nourished, to get pleasure. Okay, so they're able to enter if it is able to overcome the body immune system, which creates a solid barrier. So only immune compromised states, extreme degree of unhygienic, malnutrition, abnormal lifestyle, which disturbs the biological rhythm of the body, can lead to their entry. Otherwise, it's not so easy, isn't it? Around us, there are lakhs of crores of microorganisms. Are they entering inside the body? No, because our immune system is very strong. Okay, when your immune system fall, you are making their entry inside. Similarly, when the grahas also enter inside the body, when your immune system is weak, you will see that. Yes, now why they enter inside the body? Modern contemporary science we have seen, they enter with the different conditions, like they want to increase their colonies, they want to get the nutrition, they want to have peaceful place, then they need food for their survival, they want to complete their life cycle. These are the different things which are explained in the modern science. And surprisingly, if you see Ayurveda, a similar explanation explained for the entry of the grahas. Himsa rati archana kanksham graha grahana karanam. Now let us see one by one. There are some grahas which enter inside the body with the only intention of causing himsa. Himsa means again torturing, not killing. Okay, so they enter inside the body, they cause some tissue damage, and as a result, there will be a fight between the body immune system and as well as this organism. Either the organism win or lose, but intention is over. Intention is causing himsa. They cause the tissue injury. That's the only intention. They are little bhayanaka, amanusha, and virulent. Okay, there are certain set of grahas which come inside the body only with the intention of causing himsa. Similarly, there are certain set of microorganisms which enter inside the body with the only intention of causing tissue damage or himsa. Best example is virus. Virus don't have any other infection, other intentions. It enter inside the body, release the chemicals, and cause the tissue injury, leads to fever, and cause disturbance. That's all. It has basically don't have any intention of replication, getting good nutrition, nothing. Only few DNA virus, they can replicate in the body by using our own body cell machineries, not by themselves. That's very rare. Okay, COVID-19 is one among them. They can use our body machinery and replicate and release in thousands of numbers. Okay, so there are some infections, they are intended to cause only the himsa. Similarly, there are some grahas, they come with the only intention of himsa. That means that what it suggests, they're coming inside the body and they get resisted by the body immune system. That says that it has got an antigenic nature, isn't it? It is clearly told in Viruddhahara, Deha Pratyanika Bhutani, Deha Dhatu Virodhamapadyate. That means when any substance which is having qualities opposite to the body dosha and body dhatu, when they get inside the body will go into resist them. Virodhamapadyate. Okay, similarly, when an antigenic substance enter inside the body, our immune system try to stop it, and there will be a fight. This is what actually happening in this case, and that leads to himsa, fight. And where this himsa fight is going on, it is going on the body tissue, and as a result, war bhumis get or war field is get disturbed, destroyed, and there will be himsa, tissue injury. So this is the first intention why they are coming inside the body. Second is, it has been told rati. Okay, the word meaning of rati is actually any body manipulation movement, which desired body movements which brings the pleasure. But in other words to say, Rati and Manmata, these two are considered as the god of sex also. Okay, so Rati is all word meaning in Sanskrit. Rati is all those sexual activities also, because Rati itself is the god of sex. Anyway, now some of the microorganisms, they enter inside the body not with the purpose of causing any injury, and even not with the purpose of any nutrition. They come inside the body only to complete their life cycle, that is sexual activities. That has been explained as Rati. If you see many organisms, their intention is not otherwise. Their intention is to, they want a host. And why they want a host? Because they want to replicate. And once the replication is over, their life cycle is over, they'll go out. In the meantime, if your body immunity is not good, it may cause the disease. For example, malaria. Intention of malaria is not causing any damage to you, but unfortunately there will be a damage. The reason is malarial parasite enter inside the body, enter inside the RBC. From the schizoid stage, it gets converted into gametocyte, and its work is over. It is completed its life cycle. Okay, but meantime, if the body immunity is not good, then there may be a problem. So there are thousands of microorganisms which enter inside the host or human body or animal body to want to complete their life cycle. See, so beautifully explained by Ayurveda. Second cause of entry of microorganisms inside the body or grahas inside the body is Rati. That is for the purpose of completion of their life cycle. Now last one is Archana. They come inside the body with the Archana. In the context of Bhuta and Preta, it is told that Sarve api cha prayena ahara kamaha mamsa asrik vasashinaha. Why these Bhuta etc. they enter inside the body? Sarve api ahara kama. They want ahara. They get ahara in the form of mamsa, asrik and vasa. Okay, so that means intention of all the grahas, bhutas, etc. to come inside the body is to get nourished, to get pleased, or to get worship. That's all. Okay, worship means they want a comfortable environment. Okay, just like I told the example of tuberculosis or typhoid, it will be very comfortable in the intestinal environment. Tuberculosis is comfortable in the alveolar compartment because it is getting whatever it wants. Okay, so few enters only with the intention of getting nourishment and for causing, and not for causing any himsa, or not even with the purpose of life cycle completion. Okay, so this is the third. So beautifully, himsa, rati, archana has been explained as three important causes why microorganisms or graha rogas they enter inside the body. Now it is told that bhutas, similar to the grahas, bhutas, why they enter inside the body? It is told that they afflict only those with the jwara. Who is suffering from fever, the bhuta usually come there. Again, it suggests that the immunity is weak. Those who are suffering from vrana, again, ulcer or wounded. Even in the treatment, it is told that care should be taken just like vrinita. A graha rogi should be taken care just like a vrinita rogi. That means injured person. Just like you are taking care of the vrana, you have to also take care of the graha rogi. In case of vrana, what the care we are taking? Care is to prevent the infection. Similarly, in case of bhuta, or prevent the infection or sepsis, etc. Similarly, in case of grahas also, we have to prevent the infection. All those with the pus, mamsa, rakta, snehagandha, this part is explained already. Now again, vulnerable time and place for getting infection. What are the most vulnerable time and place for getting infection? And what is the vulnerable time and space for getting graha rogas? In the context of graha rogas, classics says that who is more prone to get graha rogas? What is the place? He says ekantavasa or shunyagharavasa. Shunyagharavasa probably taken as a smashana or crematorium, and which is a highly infectious area, isn't it? So one who is going there and staying there, he is more prone to get the infection. Therefore, usually after attending a crematorium ceremony, you should take the bath because there is every chance of getting infected. Okay. Similarly, in COVID-19 times also, immediately after going outside, immediately after coming inside the home, you have to take the bath before touching everything, because now Presently, it is a highly infectious condition. Then, meeting of the four roads. Ayurveda says grahas are common. Those who are, that is infectious grahas are quite common. Those who are going through the meeting of the four roads. Meeting of the four roads is the most infectious area. You know that. Highly fluctuating population will be there. Everybody coming there, everybody spitting there, everybody passing urine there. Highly infection. Everybody throw the everything, debris and all. Highly infectious area. Then he can, in Revati Kalpa, he says, copulation during the dust and dawn. Dust and dawn, these are considered as an unholy time. Such things should not be done. Because again, both in the dust and dawn, we will have sudden temperature changes, isn't it? So there will be humidity and increasing, and that may lead to the problem of infection. During the days of night and full moon duels, Amavasya and Purnima, again, weather changes will be there, environmental changes will be there, and there will be a pronicity for development of the infections, and similar has been told for the grahas also. Copulation during menstrual cycle, we know that vaginal tract is very much fragile and delicate and sensitive during the menstrual period, and it's a very bad thing to do the same. Wrong procedure of reading and teaching, etc. Of course, time of the Great War, I explained already, destruction of the property, city and community, etc. Near the tree, temple and crematorium. So these are considered as highly infectious areas, and person who is frequently visiting there may be having problems with this. Therefore, the same has been explained for the Graha Rogas also, that these are highly infectious areas, and person exposed to these areas is already having the chance of getting infected by the Grahas or Revati-like condition. The most vulnerable area, timing of the Grahas entry, that is Strinam Prajanana Kale, during the time of the delivery. We know that puerperal infections, then overcoming the rules of Brahmacharya, then during the time of omitting, purgation, etc., during the time of the procedures. Different types of the procedures are always well known for the infections, isn't it? So we know that in newborn, when we go for the resuscitation itself is one of the main cause for the infections. Post-resection infection or post-septicemia is quite common. Then entering the temple without taking the bath, while touching the inauspicious things, or eating without bathing. See, these are all the different things which make our body more prone to infections. They mentioned either grahas or brutas, but it is microbiological infection, micropathologies. Intake of meat, honey, jaggery, tila, and madhya, which is left by the others, that is also one of the cause. And then wandering at the night hours, the street, and as well as a burial ground. Okay, one more is incubation period. A lot of has been explained about the incubation period. Just like the Atma entering inside the body, just like Bija, the Thaila entering inside the Bija, and the image entering inside the mirror is not visible. Similarly, entry of Graha Rogas inside the body is not visible. Okay, the same is true for the microorganisms also. We come to know that I have got the viral fever only after the first symptom like fever, isn't it? I have never noticed that viruses enter inside the body. So both of these will follow the incubation periods. This is Graherapi Jayante Prachannar Vyadayo Shishu. Ayurveda explains Prachanna Vyad. Okay. Now we come to the another aspect, the world of microorganism. See, Pratyaksham Alpam, Apratyaksham Analpam, isn't it? What we are thinking is we are whole and soul in this universe, but somebody is laughing. Your population is nothing in front of me. This laughing party is microorganisms because they are koti parivara. They are infinite in number. Okay, what we think is what is visible is only there, invisible is not there. It is not true. Invisible is analpam. Okay, so they are invisible part. They are the one, microorganisms are the one which maintains the bio or ecosystem of this world. See, you know, if there is no microorganisms, a simple thing, that is milk is converted into curd. This process is not possible if there is no microorganisms, you know. There should be the presence of lactobacillus, which is a microorganisms. Okay. Air is get purified by so many microorganisms. We know nutrition purpose, the dicotyledon and so on, bacteria, they play a very important role. Even putrefaction of the dead bodies or leaves or any debris is not possible without microorganism. So how can you neglect them? You cannot neglect them, and you cannot remove them from this earth. They are the integral part of the earth. Even we also evolved from the same. Okay, so they never intended to attack. They don't have any intensity or they have got any. They don't have any intention of attacking you, but it is host tendency. Just like you go to your home at evening hours, they also want a home. Just like you want a partner in the later part of your life, they also want a security. So where they get the security? They get the security in the human host. They want a host. Okay. Without host, they cannot survive. So that's the reason they attack the body. Now, who has to take the care? We have to take the care. It is their tendency. They will definitely come. Okay. If you are in the home, what you will do? You will close the doors at night hours to prevent the entry of the thief, isn't it? And you put CCTV cameras and all those things. So you have to take care of your own to maintain your body. Similarly, if the grahas are entering inside the body, you have to take care to prevent them by maintaining the body immunity. Okay. Bubukshitaha kim na karoti papam. They are in search of an host desperately because they want to survive. They do any papa. But you have to protect yourself because they follow bhuta, preta, graha, etc. Everything they follow a host tendency. That's all. They want a host. Now, bhuta and graha and its host dependency. See, this is told that Surasuradi, Samavasa, Samasarga, Shilachara, and Karma. They live in the same body. That means after entering inside the body, after getting a host, what they will do? They live in the same body. They live with the same dhatus. They follow the conduct and nourishes, do the same karma that we are doing. By the nature, they want to attack the body due to host dependency and use of the host body. They use the human host body for all their activity. Now, if you see the portal of entry, in the modern sense, contemporary sense, we have got different portal of entry, isn't it? Similarly, for the graha, bhuta, and etc., there is also portal of entry. We have got portal of entry. One is airway, and it may be through the skin. It may be the fecal-oral entry. It may be through the wounds, isn't it? It may be through the descending infection through the lower genital tract. It may be through the lungs. There are so many portal of entries are there. Similarly, grahas also have the portal entry. Okay. Now they say Sura and Asura. This is a set of microorganisms. So I will say grahas or bhuta preta. That is in the present situation a set of microorganisms. They have got their portal of entry. How they enter inside the body just by looking. Probably this will going to cause effect over the mind, and then it causes the infection. Okay. Avalokyante. That is psychological disturbance followed by physical disturbance, psychosomatic disorders maybe. Then the bhuta, graha, etc., which are gandharva in nature, they enter inside the body by touch. See, this is a portal of entry for them by touch, sparsha, maybe through the skin or mucous membrane. Then one more type of this bhuta preta category, that is uraga, that enter inside the body by samvishate, respiratory and GI touch. Yaksha group of these bhutas, so the bhuta and grahas, they enter by bursting with a specific odor, by particular smell. They enter inside the body. Rakshas and pishacha, and by riding the person, simply attack. Rakshasa, pishacha, grahas, etc. Pitru, graha, just by observation. So just like a modern contemporary microbiology has got different portal of entries, similarly, the grahas will also have the different portal of entries. Now, if you see the origin of the grahas, it is told that physiological. This is a very important. Okay. So he says that guhasya rakshartam nirmita shulapanina. Guhasya rakshartam nirmita shulapanina. 3 months. Okay. So grahas are produced for the protective purpose. So now this is the big question, isn't it? Grahas are produced with the physiological basis. They are produced with a good purpose. Now the question comes, why they are turned pathological. Then we should say grahas. Then why we are calling it as graha rogas? Why they are producing rogas? Yes, this is the course concept that we have to understand. What I mean to say is all the grahas are produced in the body with the good intention, in the universe with a good intention. All the microorganisms which are present in the universe are there for the good intention. Then why they are causing disease? It is not their fault, it is your fault. Okay, you are not able to maintain the body immunity, and if you're not able to maintain the immunity, time to time you will have infection because they follow the host dependency. Attacking the host is their duty because they want to survive. Okay, so now grahas are produced with a protective purpose, and they protect the universe and the people in the world. Okay, puro guhasya rakshartham nirmitah shulapaninaha. So microorganisms and also produced with the good intention of maintain the ecosystem of the universe. See the role of microorganisms. They are important for degradation, photosynthesis, fermentation, nitrogen balance, okay, curding of the milk, everything. And there's a big flora of microorganisms in the intestine also. There is an intestinal bacterial flora is there. Even our intestine cannot work without these microorganisms. So, and also infection leave back the immunity also by memory cells. So we can very ensure that microorganisms are not dangerous to the society or universe. They are the integral part of the universe. Without them, anything is not possible. Similarly, grahas are also produced with a good purpose. They are produced with a very good purpose of protecting this universe. It is explained, and only the problem comes, you are following adharma and your body is more vulnerable to that. Then only the problem comes. Now this is the why grahas turns pathological. There is a role of adharma, I have told. It's because of human errors. Achara, vichara, ahara, shila. We are not doing it properly, making our body immunocompromised, immune deficient by all these methods, not following swastavrta, etc., dinacharya, rutucharya, etc., and making our body more vulnerable, and grahas will go into easily enter, microorganisms will enter easily. Okay, so all the endogenous disorders are due to the human errors. If you see hypertension, autoimmune disorders, diabetes mellitus, obesity, do you think any external cause? No, they are produced from the internal cause. What is internal cause? We are not following the lifestyle, proper lifestyle. We are not maintaining the hygiene. The problem with inside the body, not from the outside the body. Similarly, grahas and actually the problem which is coming from internal of the nijavyadi, what we say the nijavyadi, that is small. Agantuja cause was very less, and if it is coming, it is because of our problem. If you get injured, it is your problem. If any bacteria, virus, etc. is coming inside the body, your problem. You are not maintaining the immunity of the body. Similarly, grahas are also external factors, exogenous factors, agantuja factors. Okay, they are not from inside the body. So we are inviting them, come and attack me. So we cannot blame them. So adharma followed by the baby, mother, datri, and the caretaker. And that is the basic cause. So overcoming the rules and regulation of swastavrta, sadvrta, and dinacharya, that is the basic cause. Not maintaining the hygiene of self and surrounding and social and psychological, that is the cause. So proper food style and vihara, that is the cause. Hina, Mithya, and Ati yogas we are following, that is the cause of adharma, which is creating the loophole and inviting all these external grahas to come inside the body. And so we cannot blame these microorganisms for grahas. They are there in the universe with a very good intention. But they come inside the body, they cause the problem. Coming inside the body, our host tendency is their nature, character, and not their mistake or bad intention. It is only us. We are making ourselves vulnerable for their injury. Now again, microorganism and grahas, isn't it? I told in 99% of the cases of infection, there will be fever, or microorganism infection, there will be fever. Some anaerobic and opportunistic infection may not have the fever, but 99% will have the fever. Similarly, Graha Rogas, the main Pura Rupa of Graha Roga is Tesham Grishyatam Rupam Pratatam Rodunam Jara. That will be there. Now, similarly, it is explained that breast milk vitiation and microorganisms. Some of the grahas may also cause breast milk vitiation. Okay, we know the story of Putana Graha. Sri Krishna is also affected by the Putani, isn't it? Putani is a Rakshasi who is coming from the side of Kamsa to feed Sri Krishna to kill him. Okay, of course, although it is a mythological story, the message is even Sri Krishna is also afraid of. That means he is also taken care from this type of graha rogas or microorganisms, which actually affect the mother during her feeding periods or sutika kala. Okay, so relationship between the jataharani and graha, of course, they are kept in the same category. We are not going in detail. Shakuni graha is affected, then breast milk become katu and tikta, and in skanda and putana there will be change in the taste again. So like these details are mentioned. One more important aspect is morphology of the grahas. If you see the details, there will be morphology of the grahas, isn't it? See, that's how it is different from Graha Bada. Mahabharata is the first book which explains the morphology, whereas Shushruta and Vagbata also explains the morphology. And they says that some of the grahas are red in color. For example, Skanda, that means some of the grahas are fond of red color. Skanda, Skanda Pasmara, Naigamesha, they want the red garlands, they want red clothes, they want to stay in the red areas. Okay, so what it suggests, they are more virulent organisms or grahas which want the blood circulation. Okay, they like to stay in the blood circulation, Mamsa Asrik. Similarly, some grahas are explained that they like to be there in the Jalashya or watery areas. They may be possibly some of the aquatic microorganisms. Similarly, some of the grahas, it is told that they like to stay in the Gomutra or Goshala. So what it suggests? Yes, Gomutra is basically acid, and maybe they may be acid-resistant bacteria or acid-resistant microorganisms, or they are the organisms which use the cattle as a host. They have got so many things. Tuberculosis, abdominal tuberculosis is also one of the cause of spread by the cattle, isn't it? So they may be using that particular cattle. Therefore, it is called Goshala. They want Goshala. That means they want to stay near the Goshala. Okay. There are so many aerobic bacteria are there. And it is told that Akashachari. Some of the grahas are Akashachari. Okay. Or some of them anaerobic. It is told that some of the grahas, they like to stay in the Shunya Pradesha. Of course, it is somewhere it is for Shunya Ghara, Shunya. What do you mean by Shunya Pradesha? Shunya Pradesha is that Pradesha where there is no air. Means vacuum is there. That means there is no oxygen. So when he says, especially Shakuni, it has been told that it is Shunya Garvas. Okay. So it may be some anaerobic bacteria which are staying in a oxygen deficient area or no oxygen area. So like that, while explaining the morphology, he has given so many clues about the microorganisms. So explanation of grahas regarding to morphology also gives clue about certain microorganisms. And again, don't forget the hypothesis we made in the beginning. We are on the way of proving microorganisms are equal to graha rogas, and we are on the way. If you see the mythological explanations, story of the Revati, Putana, Naigamesha, etc., indicates some struggle or war, which may be indicating same struggle between body, immune system, and pathogen. Anyway, I will not go in detail. So previously also I had told most of the time the drastic war situations, always they created a new pathogen. Similarly, after a war, the new graha is formed. And these are the symptoms which are explained. Symptoms are related to the central nervous system. Symptoms are related to respiratory system. In the whole graha rogas, in general, I am telling. Gastrointestinal system, urinary system, genital system, psychological system. So it suggests that grahas will go into multi-system disorders. They are generalized multi-system disorders. They are not a one single point disorder. And one more thing is different smells in Graha Rogas. You might have been seen while reading, different smells are there in the Graha Rogas, isn't it? Outbursting of different smell in all the Grahas, Ajagandha, Visargandha, Kakagandha will be seen. And usually, outbursting of this smell is very typical of two conditions. Either there is unhygienic condition, or either there is some metabolic disturbance. Usually in metabolic disturbance, there will be change in the smell, isn't it? Okay, in case of diabetes mellitus, we have got acetone smell, sweet smell. Phenylketonuria will have got different smell. Maple syrup syndrome, again, different smell and color will be there. So usually when there is a metabolic disturbance inside the body, usually we'll get a different type of smell. In case of fever also, if you very keenly observe, if a kid is there in your home with a fever, you get a very non-specific smell. You feel, you cannot explain it, but you can feel the particular smell in the fever patient, isn't it? So that means although it is subjective, but you can experience a smell in a patient of fever. So that's again suggestive of either unhygienic conditions or metabolic disturbances because of the infection which is going inside the body. Now talking about the prognosis of the Graha Rogas, all the Graha Rogas are fast progressive and difficult for the treatment and difficult for the diagnosis. In Skanda Graha affliction, there will be always a residual physical disability or death is certain. Okay. And physical disability, that is, there may be paralysis of one leg, paralysis of the both legs, anything, hemiplegia, monoplegia, anything can happen. Some sort of disability will be there. Those with coming with the intention of hinsa is incurable, rati are curable, and which are coming with the intention of archana is easily curable. Okay. And if there is again udare, granthi and vrutta, it is again, you have to reject such patient, it is incurable. For the diagnosis purpose, Bhagavata explains a special type of homa. That homa is called as Agni Danda homa. Okay, before prognosis, diagnosis purpose. So Graharogi has to sit in front of the homa kunda. By observing the color of the flame, the prognosis is decided. If the flame is having particular color, yes, it is Sukha Sadhya. If the flame is having different color, it is Asadhya. Okay, so why this is possible? Maybe Graharogi may be outbursting certain smell, and that smell is also, there are different ions and all, organic substance. So when it coming in contact with the flame, it puts a different color. And this particular idea has been used to Sukha Sadhya and Asadhya Lakshanas, to decide Sukha Sadhya and Asadhya Lakshanas. So these are the general concepts of Graha Roga, which I explained. Hope by this time the hypothesis which we have taken that Graha Rogas can be compared with the microorganism is partially fulfilled. I cannot say it's completely fulfilled. By looking at all these references, at least we can say Graha Rogas which are explained in our science can be very well explained under the context of, with reference to microbiology or microorganisms which are explained by the microbiological science. With this, I completed almost all 2 hours. Still the treatment of the Graha Rogas, general treatment of the Graha Rogas, I have not touched. I have only talked about the basics of Graha Roga and understanding. I think I have to stop now. Too much is too bad. And again, I thank the organizers. So with this, I conclude. Thank you very much.
Thank you, sir. Sir, there are certain questions. Sir, what is the rationality behind division of Graha as Stri Graha or Purusha Graha?
Yes, this is also a good question. And probably rationality behind this, again, probably it suggests towards the virulence of the organism. Probably those grahas with the mild nature, with the less virulence, may be considered as Stri Rogas, and which are very potent and causing more virulence may be considered as Purusha grahas. Just like we find gram negative, gram positive, anaerobic, then opportunistic, many types are there. Of course, these are all the hypothetical points. But just for your question, I can say this answer.
Thank you, sir. Sir, what is the rationality behind the explanation of certain offerings in the aspect of treatment of Graha Rogas?
Yes, this is the concept of the bali. Again, if you give me one more hour, I can explain this better. Otherwise, I hope if you read my book, in that book, I have given this bali concept very detailed way. In a very detailed way, I have explained the concepts of bali.
Yes, sure. Thank you, sir. Sir, do you have any experience of treating the child, considering them as afflicted with Graha Roga?
Yes, all the infectious conditions, basically we have to follow the treatment principles of Graha Rogas. All the treatment principles of treatment of general principles of Graha Rogas will very much applicable for the treatment of infectious disorders. Whenever you are treating the infectious disorders, definitely you can follow the common rules and regulations and principles of Graha Roga treatment.
Thank you, sir. Thank you, sir, for enlightening us with your experience and knowledge. Now, I take this opportunity to express my heartfelt gratitude to the lotus feet of Pujya Mahaswamiji for providing this platform for conducting the guest lecture. On behalf of management, institution, principal, staff, and students, I would like to express my sincere thanks to Dr. Srinidhi Kumar Acharya sir for enlightening us with his knowledge. I would like to thank our principal, Dr. Kiran M. Gaur sir, for his constant support and encouragement. I'm also very grateful to Dr. Lokeshwari ma'am, Dr. Pushpa ma'am, Dr. Nayan sir for their support. Thank you one and all.
I would like to personally thank my Guru, Dr. Srinidhi Kumar Acharya sir. Thank you, sir, once again. Thank you.
Okay, thank you very much.
Thank you so much, sir. It was really an informative talk. Thanks once again, sir.
Okay, thank you.
Thank you. Thank you.